Well, good day. Granae, thank you for agreeing to do this interview with me today. I really appreciate it. And as I mentioned to you before we got on the Zoom today, I wanted to talk about how we know each other, what what I'm trying to accomplish here, and hopefully this can be a use to anybody searching online or YouTube with these questions about working with a placement agent and what, so we know each other. It was nice. Thank you, by the way, for lunch. We know each other from being involved in the Foundation for Senior Services, which is, and we're both fairly new to the organization. They say it's not networking, but it's networking with love is kind of how I would put it. But
Yes.
I don't know, how would you describe the foundation?
It's
Briefly.
a really good organization, actually, in terms of we are making it sure the people that is involved in the foundation are well versed, not only well versed, that they're doing this with passion, and this is really what they want to do in terms of not just making money, it's actually serving the community. And that's one thing I love about the foundation. And it takes a
Yeah.
village to be successful in terms of really helping a senior.
I agree. And another thing that I remember before I joined, I spoke with the owner, lack of a better word, Joyce Robertson, and she said that we vet everyone that we accept into the foundation. So, they check references, licenses, insurance, and so on. So they're only allowing really reputable, empathetic, and kind people to it. So, so you're a placement agent, and a placement agent for senior living communities. So let's go right into it. So what types of facilities, excuse me, we're not to use the word facility, what type of senior living communities do you specialize in?
Okay, so I actually do specialize on residents who are actually looking for boarding care, assisted living, and sometimes also independent living, especially if they're downsizing or they don't have any more financial sources, and they're looking for a place where they could thrive as well, and they're still independent. So that's the independent living.
Okay, so the next question I have for you, thank you for that, by the way.
Yes.
The next question I have for you is, do you work nationwide or only in specific areas?
So at the moment, I actually concentrate in the local areas, basically
Which is being the Los Angeles area,
Los
Santa
Angeles
Clarita.
County. Yes, Los Angeles County. And I'm also I'm not limited just only on Los Angeles County, and I'm willing to also serve other counties, the neighboring counties, which is Ventura, Orange County, St. Gabriel, and Kern County. Yes.
Perfect. Okay, so I believe, correct me if I'm wrong, you're licensed by the state. So the placement agency or the business is licensed by the state of California.
Yes, there's a business license, and then also to be a senior advisor. It's not that regulated as much as possible. However, I'm also a nurse, so I'm a licensed nurse, and then I came from case management, and then I also have a certification for senior advisor, just for, to understand deeply the senior community.
And are you saying, is that the CSA?
Yes,
the Certified Senior Advisor? Okay, good to know. The next question I want to ask is, how do you assess an individual's needs to recommend the right facility?
Okay, that's a really good question, David, because I came from a case management standpoint. So, and then not only just case management standpoint, I am also certified as an administrator of RCFE, which is the Residential Care for Elderly. So I know the fact that the qualifications to be in the community, especially for boarding care, it's a non-medical residential area, and also for assisted living. So I have to be careful in terms of assisting them. And also I understand the diagnosis, their capabilities, and the level of care. So that's how I could identify the residents who is actually appropriate to be in this community.
Yeah, and just really briefly, I wanted you touched on that in our lunch the other day, that a lot of times, because you have you're an LVN, a licensed vocational nurse, and you have medical background, a lot of people that might talk to someone coming out of a hospital setting may not necessarily know how to make them comfortable about aftercare steps. And that seems to me a very great, easy lead into the next conversation, which may be going into some form of assisted living.
Yes,
So
absolutely.
I love that. I
Yeah.
think that's a great superpower that you have.
Yes. And then the fact that it is a non-medical facility, that's another informations that we have to be careful, because without the right assistance from like home health or hospice, that particular patient might not suited to be in that residential care.
Mm-hmm. Well, I love that you have that experience. It just seems like it's just much more added value that is fantastic. Okay, so let's talk about financials. What are the general cost ranges of communities that you normally recommend?
So when it comes to the financial or the cost of a boarding care or assisted living, it always falls into three categories. One is location, location, location. It's like a real estate, and real estate, it depends on where it is located, and that's what drives the cost of that boarding care. Second of that one is actually the level of care. If the patient actually needs more care, that also indicates a higher needs, and then the cost as well will increase. And the third part of that one is actually preferences. When it comes to preferences, we the resident actually do have a choice between shared room, private room, private bathroom, or shared bathroom, and those are the driving information that could increase the pricing. However, I always talk to the family, because even it's in a higher residential area or a higher real estate area, I might be able to find some boarding care that actually can accommodate when it comes to that pricing. So I always give them a price range, instead of just saying just one actual cost, because we have to be realistic on that one.
Yeah, and I think what you said, and it goes to, like you said, what you do is sort of like working in real estate. You're sort of a broker, really, for senior living communities, and price is just one of the aspects of
Yes.
the whole picture. There's so many other elements that go into this process, and you're other kinds of questions and information that you need to get to be able to assess their needs and what you said, their preferences. So then you can make the proper recommendation overall. So price is not always, the most important thing. It's just this one aspect.
Yes.
Okay, great. So thank you for that. So let's go to services. So you basically find and recommend the appropriate assisted living communities of all levels of care. Are there any additional services over and above that, such as helping them with the move or paperwork? I don't know that you would help them with the move, but do you help them with the paperwork? Is there any additional services that you provide?
Yes, absolutely. So because with the resident situation, it doesn't, it's just not like one size fits all. So I always customize it. And then I have to make it sure that the family or the POA and the patient are all agreeable. And it
And the
depends on
POA is,
the
can you say
attorney.
power of attorney?
Yes.
Correct.
And
Okay.
so I would sit down with them. So when it comes to just straight transfer, I assist them with the 602 clinical notes, medical informations, and then I also assist the case management or the family to understand what other things that they would be expecting after the discharge from the hospital, from the skilled nursing facility, or coming from home. So I
So,
made all of that is well collaborated in terms of either it's going to be home health or hospice, medical equipments. So I collaborate that and making sure it's a seamless process. And then for the family and the residents not to overthink or stress about that. So that's the added value that I'm giving as part of my service.
and I got the feeling too, when we had lunch the other day, that you're very kind, you're very gentle, but gets things done. And that is so needed. And I mean, I guess that's, of course, why we get into this niche business, is because of, so that we can give that love and that special hand holding to these people at the vulnerable moments of their lives.
Absolutely. And they also educate.
Okay.
That's the very most important thing, education, so they understand the expectation. So anytime you have any questions, I try to answer that as much as possible. If it's nothing or I don't have much of the information, I'll give them recommendations. That's why I need a team that I could recommend in terms of other areas of the whole situation, in terms of their financial, some like senior law or like moving, and then
We talked about that.
they need assistance on that one. So I do have a group of people that I highly recommend, and then I value their work that I could give to them, and then it's up to them if they want to use those recommendations.
Right. But I think it's fantastic that that's another reason why I think we got into and being involved in the Foundation for Senior Services, is because being involved in the organization gives us those other professionals that are reputable, that have been vetted, that our clients a lot of times don't just need our own individual service, but they need other services, and that's our team, in other words. So I think that's awesome. You mentioned, just want to go back something. Some people may listen to this that are not really technical with, like, you had mentioned the 602.
Yes.
Can you just tell me what that, in case someone watch, and I don't exactly know what that is. So can you share with me what that is?
The 602 form is a physician's report. So before the resident will move to a new community, which is either assisted living or boarding care, that is required because there's an assessment in there that the doctor assess the patients regarding their mobility, their food, if they do have certain vaccination, and then the doctor has to sign. Yeah, that's a requirement.
Gotcha. Okay, good to know.
Physician's
Thank
report.
you. Okay, perfect. Let's move on. So the next question I have is, can you accommodate special needs like dementia, mobility issues, which you just touched on, or dietary restrictions?
Absolutely. And that is the reason why the pre-assessment interview is so important. So we could accommodate them on their special needs, because not all boarding care, assisted living will be able to accommodate them on their needs. So that's very, very important. And then of course, they just have to let me know, any restrictions. And then even with patients who actually do have Alzheimer's, dementia, I have to ask their
Mhm.
mobility, and then so I could actually appropriate community for them.
Right, that's suited to accommodate those needs.
Yes.
Okay, perfect. And the same with dietary. I know a lot of the places have to have a great chef, because if the food isn't any good,
Oh, yes.
the food's got to be good. I mean, nobody wants bad food,
Mm-hmm.
certainly. So, okay, thank you for that. Now, what kind of paperwork? We were just talking about the 602 form.
Mm-hmm.
What kind of paperwork, is there any over and above that's than the 602 form that's involved? And do you help with that as well?
Yes, coming from the hospital or skilled nursing facility, it's very important to have a discharge summary. The discharge summary, actually, it says there about their future appointments, their doctor's appointments, their medications, because the medications that they're getting from the hospital does not mean that it's going to be the same when they go home. So that has to be reconciled, and that's very important for the boarding care assisted living to have, because that's how they're going to base it. Pharmacy information, their also their primary physicians, medical equipment, clinical notes. That's important as well, because for the boarding care and assisted living, they have to understand what actually happened, why this patient being hospitalized, and just the physical history. That's very important as well. So I facilitate that. I'll make it sure that the hospitals or skilled nursing facility, it's readily available. For
Okay,
for for residents coming from home, it's basically if they do have any notes from the doctor, we recommend that as well. Or we ask like for them to talk to the primary physicians and then give us a list of medications.
so it sounds like it's important to make sure that you have all the information,
Mm-hmm.
so that there's no detail missed
Yes.
in the whole process. Okay, which I think is so important.
Yes.
You're very detail oriented. That's fantastic. Thank you for that.
Sometimes the family could also, or the boarding care could request for that one, but if I do have it already, some information, just an extra step that I could provide and collaborate with the case management, I would do it. Yeah.
Thank you for that. I have last two questions for you. One, what is the typical time frame for placing someone into a community?
That's a very good question, actually. It's a case to case basis. I'll give you some examples because, as I mentioned, their situation does not fit all, and it's a case to case basis. Um, for somebody who's coming from the hospital and the doctor deemed that the patient does not have any skilled needs, most likely that would require either the following day or a few more days. Um, However, if the client is coming from a skilled nursing standpoint, normally the case management team will identify right away if this particular resident would require to be now moved to a community because of other reasons that the family can no longer take care or for any other reasons. So it will give me enough time. It could be like weeks. And sometimes some resident cannot make that decision yet and they want to go home, but I already started the conversation. And as a matter of fact, one of my residents actually moved not until after 2 months. So
After initially speaking to you,
yes, two
right?
months.
Yeah.
Is he, and it's really a hard decision for the residents, giving up their home. They've been there for decades and decades and memories. They're independent, and all of a sudden they're moving to this unknown facility or residential area. And it's really hard to understand and grasp it. And that's why, um, with constant communication, education, and then also understanding them, and somehow they will make that decisions.
Okay, great. And thank you for that. So the last thing I wanted to touch on was, I'm assuming when someone's looking for a placement agent or anybody that you want to ask for references and testimonials from families they've worked with, correct?
Yes.
And clients that ask you, you have that to provide
Yeah.
as well.
They love working with me because I try to be detailed as much as possible, and then educate them, and for them to understand. It's easier for them to actually make those decisions when they do understand the whole picture and the whole aspect of it. And I just don't leave them hanging as much as possible. I make myself available with any questions that they do have in mind, because this is a very crucial time for the seniors and for the family. A lot of times they're making that decision in it, and not only last minute, they're overwhelmed with a lot of informations and different informations coming from the hospital and other areas. And if I could just make it like seamless, clear, and hold their hands, then we're going to be successful.
Thank you for that. That is fantastic. So I didn't properly introduce you, so I'd like to do that now for the video. We're talking with Granae. I hope I'm going to pronounce your last name correctly. Pangilinan?
Yes, Pangilinan.
Granae Pangilinan. Okay. And your company is called Pacific Coast Senior Solutions, correct?
Yes, that's correct.
Perfect. And we'll put Granae's contact information in the description part of the video, so people can get in touch with you or email you if they have any questions.
Absolutely. Anytime. I'm always available. Any questions that you do have in mind, you're always welcome to ask me. And as I mentioned to David earlier, there's no cost to seniors, there's no cost to family. I'm going to be your advocate. So utilize me, use me, and then I'll make it sure that that you have the right community and right understanding for your loved ones. And that is very, very important.
Yay. If we had a well, we do have an audience that we don't see right at the moment that will be watching this, but that was a great video. Thank you, Granae.